Okay, well, anorexia and bulimia affect 5,000 Kiwi women, and it's estimated the disease will kill a quarter of its victims.
And contrary to common belief, it's not just a condition that affects teenage girls. 5% of sufferers are male.
But new hope has emerged in the form of a clever little machine, and it's helping to change conventional thinking about the treatment of eating disorders.
So we invited one of the machine's pioneers and one of its success stories in to find out more about the Mandometer. Dr. Celia Berg and former anorexic Hayley Brown are with us. Good morning.
Morning, ladies.
Good morning.
You didn't bring the machine in?
No.
Can you tell us a little bit about it? What does it actually do?
The manometer actually train a patient how to eat and how to perceive fullness. And an anorexic or bulimic patient do not know how much they should eat, what they should eat, when they should feel full, what they should put on the plate. So the device simply teach them to normalize their eating behavior. And when the eating behavior normalizes, the psychiatric symptoms such as anxiety, depression, obsessional acts and thoughts will dissolve. So the distorted eating behavior causes psychiatric symptoms. And when the eating behavior normalizes, the psychiatric symptoms dissolve.
Okay, so you're basically retraining anorexics and bulimics how to eat. What sort of resistance have you come up against in the medical world? Are people responding to this?
Patients respond very well. 75% of anorexics and bulimics will go in remission within about a year, and 10% will relapse in a follow-up of 5 years. So today we can say that we have a cure for anorexia and bulimia nervosa, and whilst you are cured, you can stay healthy the rest of your life.
Hayley, thanks very much for coming in today. Have you had experience with this machine?
Yeah, I used it constantly for the first few months of treatment.
What was it like?
It was strange to start with because I'd never seen anything like it. And I think most patients are very hesitant about using it initially because it's obviously you've got to eat and use it. But eventually you come to really want to use it, and it sort of puts the control back in your lap.
Mm. Does what you've heard about the machine ring true then for you? Is it a case of you don't know how to feel full?
Yeah, well, you lose touch with your satiety, which is your human ability to understand where your hunger is. Often with anorexia, you're very, very full to begin with, and you sort of don't know when to start or stop with food. And this machine teaches you that by repeating the process over and over again. And it also allows you to be in total control of a sort of a pre-discussed amount of food on your plate the whole time.
So Cecilia, are you saying that anorexia nervosa is totally physiological?
Well, we say that eating disorders are eating disorders, and when the distorted eating behavior normalizes, the psychiatric symptoms dissolve, and that is a new approach.
Is it a Swedish invention?
This is a Swedish invention,
okay.
Yes.
Are there any plans to have a clinic here in New Zealand?
We would love to start a clinic in New Zealand. We have clinics all over the world, in Stockholm, Amsterdam, Melbourne, San Diego. And we are here to give some symposia and to meet with patients and parents.
Hayley, would you say that you are now cured? Are you 100%?
I feel really good. I've got my life back, so that's 100% for me.